Hello, I'm Dr. Steve Lawrence with the Infectious Diseases Division at Washington University School of Medicine, right across the park from the Danforth campus. And I'm part of the COVID monitoring team for the Danforth campus COVID response. And I'm here today to explain an important change that we're making to the COVID-19 alert level. We will be moving from yellow to orange. And first, I'd like to explain why we are doing this and how we are doing it and how we go about determining the alert levels. First, the determination is made using three primary sets of data. The first one is what's going on with our regional activity for COVID-19 transmission based on the number of cases, the percent positive test positivity, and also the hospitalizations that are occurring in St. Louis City, St. Louis County, and the surrounding counties. Secondly, we use data that it describes what is happening on our own campus. How many students, how many faculty, how many staff are being identified with COVID-19? And very importantly, is there any transmission that is occurring on campus versus what is much more often the case where people are becoming infected in the broader community and then just being recognized on campus? And then thirdly, a very important part is how much capacity do we have as an institution to be able to find and identify cases through diagnostic testing, and also what kind of capacity do we have to be able to do contact tracing for those who are exposed to cases, and then also what kind of capacity we have to provide care for and a place for isolation and quarantine for those who are either infected or exposed. And we use all of those factors to determine the alert level. And so far, just as a broad overview, the campus-specific numbers have looked very good. And what's been driving the overall alert level has mostly been what's been happening in our broader community. So this is a graph showing the number of cases over time in the St. Louis region since the pandemic began. And I want to just go back to this because if we look here, when the semester started, around late August, early September, we were just coming off of a second wave of activity in the St. Louis region, and it was starting to be on the downtrend. And because there was still moderately high levels of activity, and because we weren't sure what to expect when we brought everybody back together into an unfamiliar setting to try to navigate this new normal, we started with a cautious approach at a level of orange. And after a few weeks, we had noticed that there were very few cases being identified on campus. And what was happening in the community is that there was a gradual drift downward in the number of cases, and it looked like things were certainly improving and stable in the community at large. So about 2.5 weeks ago, with this data in mind, we did change the alert level to yellow, meaning that we can start thinking about very slowly relaxing some of the restrictions, and most notably, then we did open the Summers Recreation Center for some limited activity because we felt it was safe enough to do so based on all of these factors. Now, it just so happened that right around that time, we did start to see an increase in the community cases, and to the point where we're seeing right now about 2 straight weeks of climbing case numbers and test positivity and hospitalizations in our region to suggest that we might be hitting our third wave within the St. Louis region. And for that reason, because of that increased transmission outside of our campus confines, we are moving back to an orange alert level. But what does that mean? And first off, it doesn't mean a dramatic change in the activities that we're doing because we still are seeing very low numbers of recognized cases on campus and no transmission on campus because all of the things that we are doing, what we have in place, the mitigation strategies have been working. And so what we ask is that this is a reflection of a change to continue to be extremely vigilant and to really emphasize and really pay even closer attention to avoiding gathering together gather indoors unmasked with people you don't live with. That's going to be the most important thing to prevent outbreaks on campus. Continuing with universal masking, continuing with making sure that you're doing the symptom screening so that when you do come to campus for class or other activities, that you have made sure you don't have any COVID-like symptoms, or if you do, that you call the call center or call HABF Student Health to be evaluated. This combination of things, we believe, will be enough that we can continue to maintain the campus, and we will, at the moment, keep the Summers Rec Center open. Of course, we are monitoring this extremely closely. Every single day, we're looking at the data, and in particular, if we do start to see either a significant spike in the number of cases identified amongst student, faculty, and staff, or if we are starting to see evidence of transmission that is occurring on campus and amongst different activities, then we will have to start making some gradual changes in reducing some of these activities. But for now, I want to say thank you to the entire WashU community for doing such an amazing job of following the public health guidance so well that we have been able to show that we know how to do this right. We know how to be able to live and work and go to school in the middle of a pandemic and keep ourselves functional, even if not as fun as it always was before, but it's still moving forward, going to classes, doing work. And I want to thank you all for everything that you've been doing so far. Keep the course and take care of yourself. And we will give a further update once we have additional information or if there are changes that we need to make. Thank you.